Thank you, Deputy Speaker. I thank the member for the question. I'm happy to advise my department has engaged with Middleton Centre for Autism in order to develop autism and neurodiversity awareness training. This will be available on the Health and Social Care Learning platform in the coming weeks. Not only has this training been co-produced with service users and parents and carers with lived experience, over 30% of the content is also delivered by them, so users should expect a really authentic feel. The training covers the following three topics. First, autistic differences, which provides an insight into how autistic people experience the world. It also gives staff an opportunity to reflect on how an autistic person might experience the service and the environment of health and social care. Secondly, providing supportive environments. This gives an insight into how the environment can impact on a neurodivergent service user. An analysis of the difficulties experienced by the neurodivergent individual across a series of likely environments and interfaces is reported. Supports and materials to provide and create more supportive spaces are included. And thirdly, promoting a neuroaffirmative culture, helping staff understand how to integrate neuroaffirming practices into their work environment, from the language used to the culture in the workplace, both for the service users and for the team members. That training is key to ensuring that appropriate adjustments are made for each autistic person and to ensure our mental health service, which includes cognitive, behavioural and other therapies, is person-centred, adapting treatment and care at every point throughout a person's journey. It's important the health service is equally accessible for all, and therefore this autism and neurodiversity awareness training will be available for all health and social care staff and not just mental health staff.
Thank you, Minister. Ms Bradley for a supplementary.
Thank you, and I thank the Minister for his answer. It's certainly a huge step forward in improving the service for autistic individuals. I suppose I just want to welcome, of course, his training, but can I ask, will this be extended right through to adult mental health services as well, and is it mandatory?
Thank you, Deputy Speaker. My understanding is that it will be available to all working within health and social care and not just to mental health practitioners. Sorry, the second point of the question was? Is it mandatory? I am not sure if it's mandatory. I would have to check that and get back to the member.
Ken Collier, and following on from the Minister's answer and the supplementary, I suppose I just want to ask the Minister, over and above the specific training, does he believe that different and bespoke approach to mental health interventions for autistic children and young people as well as adults is required?
Thank you, Deputy Speaker. If the member is inquiring whether there should be a separate bespoke training regime and system in place for dealing with autism, my officials say that is not necessary. It can be done within the mental health services, but done in a bespoke way that is directed towards a person-centred pathway of care.
Mr McGrath.
Speaker, the Minister will be aware that generically there's difficulty in accessing CAM services for young people and that there is a bit of a regional imbalance. Is there any work being undertaken by the Department at the minute to address that?
Thank you, Deputy Speaker. Yes, there is. I think the member is aware that I think since I was first elected around 2011, campaigned on the broad theme of mental health. And I came to that from being a Victims Commissioner, where it was very obvious that our excessive rates of poor mental health, if I may put it that way, are a direct result as a legacy of the conflict. So it's a question of, it's one thing to say here is a service like CAMHS, but if you can't access it in a timely manner, it is actually almost cruel, because you know it is there. In the same way, some strategies that we put in are absolutely gold-plated. They're the best we can actually think of, and then we don't have the money to fund the action points year on year on year. And again, that is like Tantalus-like. Here's what you should have had. So yes, I am particularly keen to address those waiting lists and the capacity within mental health, including CAMHS.
Mr Harvey.
Thank you, Deputy Speaker. That will be question 2, Minister, please.
Minister.
Deputy Speaker, thank you. The new regional cervical screening laboratory in the Belfast Health and Social Care Trust has been operational since November 2024. The Belfast Trust was awarded the regional contract following an expression of interest process which considered submissions from trusts against a range of key criteria. The Belfast Trust scored highest in this process and was awarded the contract. While some of the HPV testing equipment, that's human papillomavirus equipment, is physically located in the virology department within the Trust and not in the cytology laboratory, it is on the same site, and all testing is being undertaken by the cervical screening laboratory team. This arrangement of a piece of equipment being located in a different location within one site is not uncommon and is recognised as acceptable practice within national guidance. The equipment located in the virology laboratory is in a room used only for cervical screening. With the implementation of primary HPV testing in December of 2023, it was necessary to consolidate the laboratories to a single site to ensure that performance standards and minimum requirements of screeners and reporting staff are met, and that public confidence in the screening programme is maintained. This is due to the marked decrease in demand for cytology testing, as it is in line with other UK regions. Even operating as a single-site model, the anticipated volume of screening samples will see the Belfast Trust Laboratory as the smallest in the United Kingdom. And I can assure members that the regional laboratory is fully operational, and between the 3rd of November 2024 and May the 4th, 2025, the regional laboratory processed and reported approximately 43,000 HPV tests for the Northern Ireland cervical screening programme.
Mr Harvey for supplementary.
Thank you, Deputy Speaker, and thank you for your answers so far, Minister. Minister, how does the Department intend to ensure that patients are informed in a timely manner of the result of the testing? Thank you.
Well, I thank the member for his follow-up question. There has been some issues in terms of the timeliness of reporting. I have to accept that that is indeed the case. Last week, though, I was very pleased. I was pleased to hear that work is being done to address that, and we look at a range of weeks in blocks in terms of how long it takes to report back to people who have been tested in terms of their results. The Public Health Agency has informed the Department waiting times are improving week on week. At 4th of May, 90.2% were authorised within 4 weeks, 0.7% in 4 to 6 weeks, 2.3% in 6 to 8 weeks, and 6.8% were over 8 weeks.
Thank you very much. Mr Chambers for supplementary.
Thank you, Deputy Speaker. Does the Minister agree with me that it is vital that women should have confidence in the cervical screening programme in Northern Ireland?
I thank the member for his question, and I understand it's rooted in previous issues which have been of a very serious nature. But yes, I would encourage women to take up the offer of cervical screening when invited to do so. Over 99% of cervical cancers are caused by the human papilloma virus, the HPV. Primary HPV testing is an automated test. It identifies the presence of HPV, and it's recommended by the UK National Screening Committee because it's a more accurate test and it will save more lives than cervical cytology. The Public Health Agency continues to monitor awareness, confidence and barriers to participation in cervical screening and will continue to use this information to inform future activities. Coverage data used as a measure of participation in the programme is now available for financial year 23-24, and it shows an increase in age-appropriate coverage across all trusts in 23-24 compared to 22-23.
Mr Carroll.
Given the concerns raised about the lack of full services provided and staff concerns raised about conditions, I would urge you to move at speed to address both these issues. Minister, how confident are you that there won't be a cervical scandal similar to that of the South with these issues raised?
Well, I thank the member for his commentary. How confident am I is the question. Well, I would like to think that I am very confident, because I think when you have had issues on the scale that were experienced by patients and service users in the Southern Trust, that everybody involved in this screening, whether it's cytology or HPV, and HPV is now the primary testing route, that everybody would be absolutely on their best game at all times. So it would be a complete shock to me if we were to return to the sort of situation we had with the Southern Trust.
Mr Donnelly.
Speaker, given the delay in HPV testing capacity, does the Minister recognise the risk this poses to the timely detection of cervical cancer, particularly for women in more deprived areas where screening uptake is already low?
Well, I thank the member for his question, and I do think it's in two parts. And yes, being timely is of the essence. I mean, it's all very well having the buildings, having the equipment, having the staff, having the protocols. But if they're not actioned in a timely manner, then the risk, quite obviously, self-evidently, is that we miss problems, or that we allow problems to deteriorate to the point where they could even be life-threatening. And as to his point in terms of people living in areas of deprivation, he will be aware that tackling health inequalities is one of my primary focuses, and over the next 2 years I hope to do enough to encourage the next Minister of Health to continue on that journey of tackling health inequalities. And that would mean we'll have 7 years of focus, and after that you should really see improvements. And the big measure for me, as I always say, is healthy life expectancy.
Thank you very much, Minister. Ms Dillon.
Leishcan Corley, and thank the Minister for his answers so far. Minister, I'm sure everybody thought that everybody was on their game and was doing their very best whenever we had the cervical smear scandal in the Southern Trust. What we really need is some reassurance around the accountability mechanisms, and in relation to the health inequalities, I think you'll agree with me, the most important element of tackling health inequalities is around education, and women need to understand the importance of the cervical smear. They also need to understand that does not detect ovarian cancer or womb cancer. We need to understand as women exactly what cervical smear testing will detect and what it won't, so that we're not afraid then to go forward when there are other symptoms.
Well, I thank the member for that. She'd be aware that I have officials working on a Women's Health Action Plan, and certainly education would be a core part of that. And I would think, looking ahead, I would prefer to have a women's strategy for women's health. But in the meantime, I think the important thing to do is to get an action plan where we can take definite actions on certain conditions that are particular, perhaps, to women. But that idea of education is absolutely core. I couldn't agree with the member more.
Mr McNulty.
Leishcan Corley, and thank the Minister for his answers thus far. The Minister will know how long and how hard people have campaigned for cervical cancer screening. After the smear scandal that did happen in the Southern Trust, can the Minister outline what measures are being adopted to ensure accurate, consistent and timely screening, and is outsourcing a part of that?
Thank the member for the question. I'm not aware that outsourcing is something that we want to do. I think we had to do it as a short-term measure when we consolidated on the Belfast Trust site. I just want to reassure people that every effort is being made to review what happened in the Southern Trust, and we've had a number of reports. There are 2 more to come, and at that point I will make a final decision. But the questions that need to be answered are: what happened, why did it happen, and that includes who was responsible for it happening, and what steps have been taken to either ensure it will never happen again, or if it's not possible to give that absolute guarantee, what steps have been taken to try and ensure it is very, 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 very unlikely to happen again. And that process is still ongoing, but I expect the final 2 reports to be published in the coming weeks, and then we'll approach the end point of our review of what went wrong.
Thank you very much indeed. Mr Butler.
Question number 3, Mr Deputy Speaker.
Thank you, Deputy Speaker. Last week I was very pleased to announce a significant package of investment in Northern Ireland's health and social care workforce. The measures I've announced will bring annual investment in the commissioning of workforce training places to £160 million. This year, my department will commission 1,065 nursing and midwifery places, a record 505 allied health professionals, and 330 social work pre-registration training places. I've also approved 24 new medical specialty training posts. That includes 13 in internal medicine, 5 in core psychiatry, and 6 in other specialties. Also to be delivered through this investment will be 378 places on the Northern Ireland Medical Foundation programme. This will provide a place for every graduate from Queen's University Belfast Medical School at QUB. and also the first cohort of graduates for the GEMS programme at Ulster University. Collectively, the total number of medical training posts across all these programmes, commissioned by my department from the Northern Ireland Medical and Dental Training Agency, now stands at 2,219. Our health and social work workforce are our greatest asset. Without their skills and their dedication, there is no service. So the investment I've announced forms a key part of my department's ambitious 3-year plan to stabilise, reform and deliver a more sustainable and effective healthcare for everybody. It means we remain on the path towards securing the workforce across health and social care, which will help us meet rising demand for care and also support the transformation of services, particularly in primary and in community care.
Mr Butler for a supplementary.
Thank you, Mr Deputy Speaker. I'd like to commend the Minister for what many are rightly saying is some of the most significant increases in training places in many years. Can the Minister perhaps give us an indication of just how significant these increases would be across, in particular, the AHP programmes to year? Thank you.
Well, I thank the member, and I think the AHP, the Allied Health Professionals, is a really important second largest block within healthcare after the nursing. And we have, as I say, a record 505 Allied Health Professional pre-registration training places to be commissioned by my department in this financial year. So the breakdown the member may be interested in is as follows. Physiotherapy, 110 training places, and that represents a 37% increase over the last 2 years. Radiotherapy and oncology, sometimes referred to as therapeutic radiography, will get 25 places. That's a 56% increase compared to last year. Diagnostic radiography, 94 places, a 38% increase over the last 2 years. Occupational therapy, 93 places. That's a 69% increase on last year's commission places. Paramedics, 65 places, a 30% increase on last year. Speech and language therapy, 56 places, a 100% increase on last year's training numbers. Dietetics, 35 places, up 66% on last year. And podiatry, 27 places, a 35% increase on last year. These numbers represent an overall increase of 100 places on training places commissioned in 24-25. And these roles are critical to delivering care and enabling service transformation across hospital, community and home settings. And they will help free up more experienced staff to take on advanced practice and leadership roles.
Mr Dixon.
Thank you, Deputy Speaker. Thank you, Minister, for your answers so far. Minister, can you confirm to the House whether your department has conducted a regional skills gap analysis across trusts to ensure that those commissioned training places align with actual demand?
I want to thank the member for his question. I am not going to be definitive in my answer about that actual, because you were very specific. The member was very specific about the review that he had in mind, so I will take that away. But as a broad answer, yes, we do look at the gaps on a trust-by-trust, even a hospital-by-hospital basis. And I hope the member is aware that although we have 5 geographically defined trusts, it is my intention and it is my drive within those trusts to ensure that everything we do is delivered on a standardised regional basis, and to do that we have to look at the workforce and how it's distributed to make sure it's in the best place to do that. But I will get back to the member on the specific.
Mr McCrossan.
Thank you, Speaker, and thank the Minister for the answers to the questions given so far. Minister, given there are questions if these training places meet the level of demand for services, can you provide an update on when the safe staffing legislative process will commence?
I thank the member for the question. We have been looking at the legislative programme that we can bring forward in the remaining 2 years of the mandate. I can assure the member that it is my desire that the safe staffing legislation will come forward before the end of this mandate. As to an exact month, I cannot commit to that yet, but it's one of the top 3 pieces of legislation that I desire to bring to the House.
Thank you very much.
Speaker, and just following on, and you've kind of generally answered it, can you ensure or guarantee that, and I do welcome the posts, that there is a fair allocation across our hospital sites, in particular around the medical posts, because what I find is that a lot of the training posts are Belfast-centric, and when young ones go to train in Belfast, They don't necessarily then, they set up home and come back down to the northwest. If there was a fair allocation of these posts from the start across the hospital sites, we can ensure that we can retain and build upon the skills and the teams that we have, particularly in the northwest and in particularly out in the Galvin hospitals. Thank you.
Well, the assurance I'd like to give to the member is that I'm acutely aware of the need for regional balance, and I would like to assure her that every week, not a week goes by when I don't look at waiting lists and at issues and say, why is best practice in that trust not being replicated and made out into common practice in all 5 of the trusts? I would just put in the proviso that, of course, Belfast Trust offers a lot of regional services, so there will be a kind of weighted bias towards people who are working in the Belfast Trust because they're delivering for the whole of Northern Ireland. But the issue that she mentions is really important. Not just making sure that we've got the right distribution, but also a point that if people come up here to Belfast to train, there is a possibility they'll just say, I kind of like it here, so I'm going to stay. So it's on my radar, is all I can assure the member.
Thank you very much indeed. Mr. Chambers.
Question number 4, Deputy Speaker.
Minister.
Thank you, Deputy Speaker. My department is facing an extremely challenging financial position this financial year. Members will recall that compared to the level of need being driven by increased demand, health inflation, pay and trust deficits, among many other factors, my department was facing a £400 million shortfall this year. That position has now changed, but regrettably not for the better. The additional pressures that the final budget has added in terms of the ring fencing of 165 of the department's existing budget for waiting lists, and the difference in the allocation for the rise in national insurance contributions compared to the original planning assumptions means the latest assessment of the funding gap is now over £500 million. In this context, we're having to look to make deeply unpalatable decisions about fundamental, inescapable cost increases, such as pay and price inflation, as well as the additional costs associated with changes to national insurance contribution and the national living wage. We currently await the pay recommendations coming out of London for doctors, dentists and allied health professionals. I think that is imminent. I have said before, all things being equal, I wish to enact those recommendations at speed. However, I need to make you aware, while I will continue to do all I can to build on the unprecedented £200 million of savings delivered by the HSC last year, this budget does not leave me in a position where I'm genuinely struggling. It leaves me in a position where I'm genuinely struggling to see a way forward. So while I very much welcome the rather belated executive focus on waiting lists and the clear direction that this is where executive colleagues want me to focus, it's also clear that unless the executive takes some shared responsibility, counterintuitively this could very well be at the expense of using that funding to prevent funding cuts across other services.
Mr. Chambers for supplementary.
Thank you very much, Deputy Speaker. I thank the Minister for that rather sobering update, which perhaps will come as a bit of a reality check to some in this House. Given there is the speculation that the pay review recommendations for this year are likely to be published any moment now, I welcome the Minister's commitment to moving swiftly, within reason, to ensure that our health workers aren't left waiting for clarity on their pay while colleagues in equivalent roles right across the rest of the UK see increases appear in their pay packets. Thank you.
Was there a question in there, Mr. Chambers?
Well, I welcome the member's statement. What I would say in terms of the pay pressures is that we made an assumption, we had to make an assumption in working out our budget, and that was of a 2.8% pay rise. As I have said already, I think the two sets of recommendations for allied health professionals on the one hand and doctors and dentists on the others have been received by the Department of Health and Social Care, so we await the publication of those figures and the response of the Secretary of State, Wes Streeting. I am no longer confident that we have budgeted a large enough percentage to meet what we are expecting to be published.
Mr. Martin.
Thank you very much, Deputy Speaker. Minister, you'll no doubt agree with me that actually treating illnesses early on is better in terms of patient outcomes and also in terms of the cost implications for the health service. In light of that, would you commit to assessing the cost to the health service of undiagnosed celiac disease and the resultant health complications with a view to speeding up diagnosis of this illness?
Well, I thank the member for his question. I will certainly take that away to officials. I am aware of celiac disease, but only at that, as it were, superficial or headline level. I will certainly commit to go away and checking what we do as a department and as health trusts in terms of the service. I'll also check whether it's a consistent service across the 5 trusts, and I'll get back to the member.
McAllister.
The Minister for his answers. Almost a year ago, you stood saying almost the identical thing with perhaps a little difference in figures about having to make cuts that would have detrimental impact. But none of those cuts happened, the ones that you and your staff outlined at committee. So what happened and why weren't those cuts, and will it be the same again this year? Is it just fear-mongering, or is it actually trying to find efficiencies and wastes in the 5 trusts across Northern Ireland, perhaps on the administration costs?
The member says slight variations. 400 million to 500 million is not, in my estimation, a slight variation. It's not a slight variation in the view of the trusts or the department, or I could well imagine the Department of Finance. These are not slight variations. These are major variations. And the Trust made an unprecedented £200 million of savings last year. The member seems to be disputing that. If she cares to write to me with the detail, I'll certainly look into it.
Thank you very much indeed. Ms Egan.
Number 5, please.
Minister.
Thank you, Deputy Speaker. The South Eastern Trust reports that as of the 12th of May this year, there are 929 social workers employed across adult and children's social work services. That equates to 861 in terms of whole-time equivalents. On the 31st of March 2023, there were 784 whole-time equivalent social workers in the South Eastern Trust and 807 on the 31st of March 2024. So I'm pleased to report that means an increase of 77 social workers between 2023 and 2025. The Trust has 53 social work vacancies at Band 6 and 11 at Band 7. There are an additional 95 staff absent from work due to sickness, and the Trust inform us they are actively managing sickness levels and providing staff with support to enable them to return to work. Vacancy and absence rates can impact on the availability of social workers, leading to waiting lists or allocated cases being used to manage referrals. So the Trust has implemented a review and monitoring process to ensure the safe management of cases awaiting allocation within children's services. The South Eastern Trust participates in a number of department-led initiatives aimed at stabilising the HSC social work workforce, and that includes the fast recruitment of newly qualified workers. It's envisaged the majority of the 53 vacant Band 6 posts in the Trust will be offered to newly qualified social workers between June and September this year. In fact, approximately 240 vacant posts will be offered out to newly qualified social workers across all 5 trusts in the coming months. The South Eastern Trust has advised it's prioritising attraction and retention initiatives for social workers, also developing the use of a social work bank of staff to fill temporary vacancies. Despite these efforts, I have to say there continues to be an inadequate supply of social workers to meet service demands regionally, and my department is regularly reviewing and seeking to increase the number of commissioned training places to meet the demand.
Ms Egan, you have 30 seconds.
Thank you, and thank the Minister for his answer. I understand the Social Care Workforce Review in 2022 indicated that an increase of 60 university training places for social workers would be required every year, but last year there were 20. Can I ask how many there's going to be for this upcoming year, and will that be enough to meet demand?
The exact number I do not have to hand. We have made great strides, I think, in recruitment and getting away from using agency staff, so we're much more efficient, but I'm afraid I'm going to have to write to the member in terms of the exact number that she's seeking.
Thank you, Minister, for keeping for the time. That ends the period for listed questions. We will now move on to 15 minutes of topical questions. I call Colin McGrath. Colin.
Deputy Speaker. Minister, after your recent visit to the Down Hospital and meeting with the dedicated and hard-working staff there, you hailed it as becoming one of your favourite healthcare settings. Do you agree with me that the Down could be offering much more, making its all-important contribution to the healthcare transformation that we need to see?
Deputy Speaker, thank you very much, and I thank the member for his question. I've been, I think, 2 or 3 times, certainly to the Down, and what I really like about it is, if I may use the expression, the vibe. There's a really good feel walking into that hospital, and that's created by the wonderful staff who work there. I've visited many of the services, so I think there's a great range of services already offered in the Down. You've got your urgent care and minor injuries, and they are both phone first, by the way, which I think is working very well for them. I visited the frailties for older people, and I'll declare an interest on that one. Hospital at home, which is a vision of the future, getting all the services that you can access in a hospital like the Down delivered to you through your front door. Endoscopy is going very well, and of course I think there's about 4 dozen inpatient beds. Where there is definitely immediate scope is in cataract operations. The Down specialise in cataracts, and on my last visit we were discussing that, and they were making very clear they do have spare capacity. They can increase their delivery. So out of that 215 million that we've announced and ring-fenced for waiting lists, I have encouraged the South Eastern Trust to get in touch with the department and say we are ready and able to go with more cataract operations.
Mr. McGrath for a supplementary.
Thank you, Minister. Thank you for that reply. And you've referenced it. Would you also agree with me that the current urgent care service could be upgraded and enhanced too? It would enable some treatments a little bit closer to home, but it would also ease the pressure of the overcrowding that does take place at the Ulster Hospital in Dundonald.
I thank the member. I'm not going to agree with him on that, and there's a reason for that. I did visit the urgent care and I spoke to the staff, including consultants, and the question was asked, what more could we do? What more could you do? What would you change if you had the magic wand? And really, there was a contentment about the service that is being offered at the moment, and a realisation that actually it works well in that rather than maybe people going to the ED at the Ulster Hospital and then being referred back to the Down, which is the locality where they live, it's better that they're going to the Down where they may be treated and sent home or become an inpatient and then referred just the one time. The only ones who need to go to the Ulster are going to the Ulster. So I think it's working pretty well, but everything is always under review. And the most important thing for me when I go out and visit is for people to say to me, here's the obstacle in me delivering on a daily basis, and here's the fix.
Thank you, Mr. Deputy Speaker. Minister, in recent weeks there have been reports that the Department of Health would not provide additional recurring funding for ambulance cover in the Western Trust area unless the removal of emergency general surgery at the South West Acute Hospital was made permanent. Can you provide any clarity or reassurance in the matter?
Deputy Speaker, thank you very much. I am aware of the claims, and I find them quite disturbing, actually. So first of all, no decision has been made on a permanent move, and that decision rests with the Western Trust, not with me. They will make a decision, and I don't know what decision they're going to make, and then it will come to me, and it will be up to me to endorse it or not. So I want to be clear, as Minister, I'm categorically stating it's not the case that any additional funding is dependent on the temporary change becoming a permanent change. And perhaps the rather unfortunate and mistaken reflection in Trust minutes relates to the fact that any such request for funding would be non-recurrent, but that's simply reflecting the fact that these arrangements are temporary. But that's completely different to no funding being made available.
Thank you. I thank the Minister for his very clear commitment, and I hope it will provide some reassurance for the people that have been greatly distressed by the recent reports on the matter. Can the Minister give a commitment that, in line with the recent Requia review of the pathways, that the Trust has now better engagement with the Northern Ireland Ambulance Service? Thank you.
I thank the member. I can give that assurance. I'm very aware of the sensitivities involved, by the way, particularly for people living in the catchment area of the South West Acute Hospital. I'm more than happy to provide that reassurance. In relation to the point on ambulance capacity, it's my understanding the Western Trust has daily engagement with the Northern Ireland Ambulance Service, daily engagement with the view of minimising the impact on capacity and including where necessary the use and best use of outside ambulance provision. I still firmly support the original recommendation within the RQIA review of a more sustainable and resilient ambulance model, supporting emergency surgical services within the Trust.
Ms Egan.
Thank you. Minister, can I please have an update on the details of the hospital reconfiguration framework?
Well, I thank the member for her question. That was put out to public consultation. We have had, I think, a vigorous and very welcome set of public responses. Those are still being analysed by my department, so we are not yet at any position where we're going to give a more detailed vision of the network in terms of which hospitals will provide which services.
Thank you, Minister. Can I ask then, are your department effectively evaluating any transformation that has already successfully taken place in order to garner more public and political support?
I'm not aware that we are, no.
Deputy Speaker. Minister, I'm sure you'll have heard by your statement yesterday, 24 hours on, many members of the public are generally pleased with the announcement you had made yesterday in relation to GPs funding. Obviously, the GPs are not happy with the funding proposed. However, in your statement yesterday, you referred to people making 50 and 100 calls, and indeed some have been told to ring back the next day. In relation to the funding, how do you believe what announced yesterday will address that for the anticipation of those people who are making those calls?
Minister.
Deputy Speaker, thank you very much. I thank the member for his question. Well, we did put a number of proposals on access to the GP committee. One of them, for example, was to say make some of your appointments pre-bookable, so that if you are caught in that kind of speed dial, redial situation, that you don't necessarily get to the point where when you finally get through you're told, I'm sorry, all today's appointments have gone, and that's it, start again tomorrow, go down that big snake to go. So these were all, we think, very practical recommendations, and were achievable at no cost to the GP services. So we are asking the GPs to implement our proposals anyway. Obviously, they have rejected our proposals, have rejected the 9.5 million of additional funding. They will be going back to their members. We await to see what the response is going to be.
Can I welcome the Minister in terms of that proposal and indeed the idea that's been put forward? But given they may have rejected it, I presume they will receive the money. So if in receipt of the money, is that coming with a precondition that they must follow that? And if not, what sanction can you take as a Minister if they don't follow those ideas laid out yourselves in relation to that funding?
Well, I thank the member. Well, obviously, it's a tense situation, and I don't want to make it any worse. What I would say to them about the 9.5 million, which I have decided to implement and to pay anyway, is that some GP services genuinely struggle, and we've seen handbacks of contracts over the last couple of years. I had a grave concern that, for example, indemnity was still a toxic issue, although we provided a temporary solution for last financial year. We have now identified a permanent solution. That requires £5 million of additional money being put in. Had we not done that, some more surgeries might have handed back their contracts. They've had a hike in national insurance imposed upon them by the UK government. They weren't expecting it. None of us were. I didn't think it was fair to ask them to take that hit, so the department have taken it. 3.5 million is our estimate, and as I said yesterday, if it's higher, we'll go higher. If we didn't do that again, you were potentially looking at a GP surgery handing back the contract. So we're trying to do what we can to stabilise primary care.
Thank you. Minister, could you provide an update on the business case for the new £1.4 million investment into Carrickfergus Health Centre for the new mental health facility?
Deputy Speaker, thank you very much. No, I can't, but I can go and get it.
Thank you. Well, I'll go on to another question then. So in the previous debate on diabetes, the audit and the utilisation of data, you detailed around the Encompass system and how that could be obviously utilised. Now that would be for primary care. Just in terms of secondary care, how could that data be collected? Because those obviously with type 2 diabetes, that's how they would be engaged. And so I was just wondering, how is all that data being collected through this Encompass system?
It should be related to the first question that you asked. Now, it's up to the Minister where he wishes to answer or not. And knowing the Minister for being the good sport he is, I imagine he will. Minister.
Are you allowed to say a Deputy Speaker has just stitched you up? I think that the member, if I heard her correctly, she was talking about Encompass being in primary care. Encompass is in secondary care.
Sorry, apologies.
It's in the hospitals. So as long as it's in the hospitals, Encompass will trap that.
Deputy Speaker, and can I thank the Minister for joining myself and Mr Gaston recently to visit the Turning Point in Ballymena, and I hope, Minister, you were able to see firsthand the tremendous work that the charity are delivering. Can I ask, Minister, do you agree that Turning Point NI are a fantastic example of community and voluntary sector partners for the work that your department is committed in delivering?
Mr. Speaker, thank you very much indeed, and I thank the member for the invite, which I was more than happy to accept, and like so many of the other visits that I am so blessed to take part in, I really enjoyed meeting with Turning Point NI, one of many fantastic voluntary and community sector organisations doing inspiring and fantastic and wonderful work on the ground for people with mental health issues, some of whom are in crisis. And I believe it's an invaluable service and felt as such by the local trust. And I know they receive no formal HSE funding, but they still take those referrals from GPs, from community mental health teams, community and voluntary sector and self-referrals. So I'm aware the community mental health team in Ballymena also see Turning Point as a very useful and very important partner in the Ballymena area, and I wish we could do more financially to support them.
Thank you, Mr Deputy Speaker, and I thank the Minister for his response and kind words. Minister, do you accept that there is still a lot of potential to better utilise the community and voluntary sector in the delivery of some really important mental health services across Northern Ireland?
Yes, I thank the member, and of course I fully agree, and I point them to Action 17 of the Mental Health Strategy. Action 17 commits the Department to fully integrate the community and voluntary sector in mental health service delivery with a lifespan approach, including the development of a protocol to make maximum use of the sector's expertise. And the more visits I undertake, the more impressed I am with the innovation and the clear motivation to help. There's currently an independent review underway on that scope, scale and capacity of the voluntary and community sector. I expect one of its clear outcomes will be the creation of a protocol which will help ensure the most effective use of the sector's expertise and resources, and I go back to my role before elected politics as a Commissioner for the victims and survivors of our conflict, and the realisation that on a day-to-day basis so many were suffering poor mental health and would receive their direct help from voluntary and community organisations, whether they were people who they trusted, which was very important to victims of the conflict, of the Troubles, and so I have a deep respect and an understanding of the work they do from that day forward.
Mr McMurray, and you have a minute.
Speaker, and thank you the Minister for the answers so far. How many GP practices are on special measures of financial support or have formally indicated a risk of closure or contract handback?
Once again, contract handbacks. There are a number in that situation. Regrettably, there have been 16 handbacks since financial year 23-24, 11 in 23-24, 5 in 24-25. There's been one contract removed. I hope that answers the member's question.
Time for a short supplementary, Mr McMurray.
Thank you very much. Thank you very much, Minister. Has there been any financial or workforce modelling undertaken by the Department in order to assess or mitigate against the impact of such potential changes?
We have a crisis team who go in and help any GP service that feels they are under pressure. So yes, we do look at the underlying reasons and try and come up with workable solutions.
Minister, thank you. Apart from that interruption, the time is now up. We'll just take our ease while we hand over the top table.